Well, Mary, we now have completed your exam. We've done the clinical breast exam where I examined both sides and found that mass on the right. And we did the SureTouch exam of that area on the right as well. We have a report from the SureTouch exam, and we have several pieces of information here that are very useful to us. This is the area where we found that mass. And on this picture, it gives us a picture of how hard that mass is, and also the shape of the mass. This measures the size of the mass, the width and the height of it. And this gives us a picture of how hard that mass is. And it tells us how hard it is relative to the surrounding breast tissue. So we have a lot of information from the SureTouch exam. Do you understand what you're seeing here?
What do the different colors mean?
Right. Well, the colors are related to how hard the mass is. For example, this red area suggests that's where the main portion of the mass is, and it's quite firm. The normal breast tissue is all this blue area surrounding it. So you can see the surrounding breast tissue is soft relative to this mass. And it gives us an idea about how hard it is, and also whether there's just a single mass or whether it's a lumpy mass, for example, if there were multiple peaks.
Okay.
So you can have this examination.
Okay.
And in addition to that, I have some patient information that's offered from our center about SureTouch and about breast health. And this is for you as well.
Thank you.
Okay? So we'll take care of this next week. So, Barbara, you were concerned about that mass in the right breast, and I examined it with a physical exam, but then we did the SureTouch exam. And what we saw, this is the results of your SureTouch exam. We examined that area in your breast where you were concerned, where you thought you felt something. But the SureTouch exam didn't feel anything or didn't identify any abnormality. There was no hard mass in that area. It was all glandular tissue, consistent with fibroglandular tissue. And these pictures just validate that. And so it's reassuring not only on my physical exam, but to have a documentation of normal glandular tissue. You have a small breast cancer there. We already know that. On examination, we showed that it is on the right side. And this is the picture of what the breast cancer looks like. Mm-hmm. It's a little bit more diffuse, a little bit more spread out. It's small though, and this gives us a picture. It's more multilobulated, meaning it has more than one peak. Mm-hmm. It's not a single peak like a cyst.